Athletes nowadays are going out of their way to be the next Olympic star, and the obsession is starting in high school. Teens have become infatuated with training to be the best version of themselves. This often results in a few injuries along the way. Let's ask some of our Voyager athletes what injuries they've suffered through.
I had a hairline fracture and a severe sprain playing soccer last season.
I fractured my growth plate while cheerleading.
I got a stress fracture during dance.
You know that if you play sports, you are required to fill out a number of forms that detail all the symptoms of having a serious injury, like a fracture or a concussion. One of the most common injuries in athletes is called Medial Tibial Stress Syndrome, also known as shin splints. This disease is commonly found in athletes who train too hard too fast. Generally, what happens is that the muscle, tendons, and bone tissue around the tibia become inflamed. This causes pain along the border of the tibia, where the muscles attach to the bone. This disease can affect the way individuals perform daily functions in their everyday lives. The symptoms include pain along the tibia that can be sharp and razor-like or dull and throbbing. There can also be mild swelling around the tibia. People with MTSS will experience this pain during or after exercise. They should see their doctor immediately if the pain continues after an entire day. There is a large population of people at risk to get shin splints. Some of these people include runners, military recruits, dancers, cleated athletes, and people with flat feet. 20% of runners will experience shin splints in their lifetime. A doctor or trainer will diagnose medial tibial stress syndrome if they are able to rule out 3 other shin problems. The first one to rule out is a stress fracture, which is when the bone has a minor break due to a heavy amount of training. The second shin-related problem is tendinitis, which is when tendons become inflamed due to a tear in the tendon. The final problem to rule out is chronic exertional compartment syndrome, which is when pressure in the muscle builds a dangerous amount of pressure that causes pain. When the doctor is able to rule out all these shin problems, then they will diagnose medial tibial stress syndrome to the patient. Treatment is often easy for people who have MTSS. Most doctors recommend that patients stay away from activity and rest for 3 to 6 weeks. This also varies on how serious the shin splints are and can cause the patient to rest for more or less weeks. There are 6 main components for treating shin splints, including icing your shins, resting, compression, anti-inflammatory medicines like ibuprofen and aspirin, stretching, and finding shoes that will support the patient's foot better. There is also a surgical treatment option that is extremely rare but used in severe cases. The surgical route is for people who do not respond to the 6 non-surgical treatment options over an extended period of time. Treatment varies for every person diagnosed with medial tibial stress syndrome and can be tedious, but if the athlete follows the correct treatment, they will be able to return to their activity healthy and ready. In order to prevent shin splints from happening or from reoccurring, the athlete must follow a number of steps. First, the athlete must find a proper fitting athletic shoe that is designed for the activity. There are also shoe inserts that the patient can find that will slip into their shoes in order to give their feet more support. Second, the athlete should make a plan to slowly build back up on the training they left off on. Training too hard will cause the athlete to possibly have shin splints again. The patient should cross-train in order to use different muscles to give their legs a break. Cross-training includes cycling, swimming, and jogging for athletes returning back to running or a cleated sport. Another weird method of prevention that has become quite popular in the running world is barefoot running. It is what it sounds like. People run without any shoes on to relieve their feet from their shoes to see if their shoes are the problem. Barefoot running has been proved to be more healthy than running with shoes on. Just make sure you aren't running on a gravel road. You might get a different injury.